Good morning. You are watching Sunrise at Sea here on CTV. And this morning on Wellness with me, Sandra Cope, I will be speaking to the good doctor yet again, Dr. Martin Adupet from Kampala Hospital in Kololo. And he is an obstetrician and gynecologist. Good morning, doctor. How
Morning, Sandra. How are you?
I'm good. It's good to see you.
Good seeing you again. That time's
I still exactly, and I still wanted some more information this time around. I want to know what to do to prepare for labor and childbirth. Now, most women, when they are getting to their due date, what they start doing is taking these extra herbs. They give them, like, I don't know, this stone that they put in water and then drink the fluid, and they're told to do all sorts of crazy things just to make, because everyone is scared of labor. So they want, like, no pain, no this, no that. So what would you advise? Is this safe? Because is this safe?
Okay. Thank you. Thank you for hosting me once again on this very critical but important issue, right? Yes. So, the third trimester is between 28 and 40 weeks, so basically from 7 months onwards.
Yes.
And the reason WHO, the World Health Organization, recommends 5 visits is because it's the most critical period.
In the third trimester?
The third trimester is the most critical period in a woman's pregnancy.
Okay.
Why? This is because we need to come up with what we call a birth plan.
Exactly.
How are we going to give birth?
Yes.
You know? And the only way you can know how you're going to give birth is because many factors have to be aligned in a certain order.
And the history comes into play.
The history comes into play. The examinations you've been having come into play. The investigations you've been having come into play.
Yes.
Because there are 2 types of birth plans.
Okay.
There is having the normal delivery.
Yes.
You know, pushing a baby normally. And there's having the cesarean section. But as doctors, we recommend all mothers to have the normal delivery.
Yes, but a normal delivery chooses you.
The normal delivery, something like that, something along those lines. So many times, especially around this third trimester, mothers are getting a lot of unsolicited advice, especially first-time mothers.
Yes.
They're getting a lot of unsolicited advice from well-intentioned people. And that is why I advise people, when you get this advice and you're not sure, ask your health worker. I'm being told all this, is it okay? I'm being told. Most times the doctor will say, continue that one. If you want to do it, no problem. Or if you don't do this, because
you shouldn't be under pressure to do it.
Don't be under pressure to do it, because more often than not, it will not help you.
Now, let's look at the C-sections, because there are 2 birth plans. There's the normal birth. I know birth chooses you, you don't get to choose it. But most women are actually choosing C-sections. They decide when they are going to. It's like, no, you see, my mother's birthday is on the 2nd of January. So they told me my estimated date of delivery is like the 10th of January. But since I'm in my last trimester, I've booked an appointment with my doctor. I'm going to have a C-section on that day. And I would like you to tell me, because a C-section is a very, very serious operation, and they do not seem to fathom this.
Exactly.
Yes, what would you advise, doctor?
I would advise that people should know what a cesarean section is. You know, like you say, it's a very serious operation, which is used as a last resort.
A last resort.
Which is meant to be
last resort.
Exactly. Meant to be used as a last resort of management for either a baby or a mother whose condition is serious and warrants immediate intervention. You understand?
Yes, I do.
So it is not an operation which should just be done just for the sake, because someone wants. You know, and more often than not, unfortunately, in our society, most women are opting for a cesarean section because they want to keep their lady parts intact.
Yes.
You understand? That's the main reason why they do not want to go through those hours of labor. You know, their lady parts are affected, issues like that. So
the healing process.
The healing process.
Oh, there's what do you call the episiotomy?
The episiotomy, the stitching down there, around that side. So most people want to opt for a cesarean section. But a cesarean section comes with many complications. You know, you lose more blood.
Yes.
Any of your organs inside from the bladder, anything can be injured during the cesarean section. You can get infection.
You're very
exposed. Pain is more. Exactly. So as compared to someone who pushes today and goes home the next day, Sandra. If you're operated, you stay in hospital for 4 days. The pain is more intense. You have lost more blood. You take a bit longer to recover as compared to someone who pushed and is going home the next day.
Yeah, that's true.
So with cesarean sections, it is meant to be as a last form of management for a pregnant woman who is having issues either with herself or with the baby. Now, with cesarean section, there are two types. Let me just bring this in. There's what we call elective or planned.
Yes.
You know, elective or planned is that where you sit with a couple and decide that we should do this operation on this day.
Yes.
Now, you can only decide this once you have hit the 39-week mark.
Oh, so it's 39 weeks.
39
After 39 weeks, then
yes. The baby
you
is now
have to
mature.
have the baby, yes.
The baby is now mature and ready to come out, okay?
Yes.
So 39th week, that is now when you can sit with a couple and say, you know what? Once we reach 39 weeks, we can sit 3 of us and decide on an appropriate date.
Yes.
That is beneficial, or that can work for me
and for you as well.
Yes. So you're like, can we do it 10th, 11th, 12th? And you're like, no, my other son's birthday is on 11th. I can do it on 11th,
before.
doctor. Yes.
Yeah.
I also want it on the same day.
Yeah.
Then the doctor is like, I'm also free on that day. Let us do it on that day. So it is a planned operation, which has been agreed on by both the couple.
So that's the elective.
Exactly. That's elective. This is very different from the emergency cesarean section. The emergency cesarean section is one where we have to intervene before even the due date, or even during the due date, or even during labor, to save the life of either the mother
or the baby,
or both.
Okay.
A perfect example is a lady who begins bleeding torrentially or heavily at 8 months.
Yeah.
You know, sometimes it might be unwise to allow her to progress during labor and push her baby. You have to intervene there.
Yeah.
Or she decided to have a normal labor, and then for one reason or another the baby gets tired.
Yes.
And you have to intervene.
They say that women who have had a C-section should not go past 4 babies.
So we advise women not to have more than 4 babies for those who have had cesarean section 4 times, because the risks in the subsequent pregnancies are much higher. So if you want a large family of 6, 7 children,
you can't.
Not advised.
Doctor, let's talk about, I feel also, apart from the reason you gave, I feel most women do not want normal labor, because then you have to go through the labor pain.
Hours of labor.
The hours of labor. So they are afraid of that, and they opt for the C-section so that they can skip that bit. But I'd like us to talk about the epidural, because with an epidural, you get that jab in your spine, and all the pain goes away, and you get to still push your baby. So it really decreases that labor pain.
Yes.
Can you tell me more about that?
So you know, especially as times progress.
Yes.
We try and make things as easy as possible for people, and one of the ways we have tried making things easy for pregnant women not to have a lot of pain during labor is epidural. Epidural, like you say, is just an injection given at the back by
of the spine.
Of the back of the spine by an anesthesiologist, someone who helps you to sleep and relax in theater. They're the ones who give it to you, such that you have what we call painless labor.
So it just manages the pain. It doesn't put you to sleep. It just manages
the pain. It doesn't put you to sleep. You're still getting the contractions, but you can imagine getting contractions without feeling the pain.
You see?
Yes, it's very nice. Unfortunately, it's out of the reach of the ordinary Ugandan.
Yes.
Because it's not something which is routinely given in any public hospital, or unfortunately, because it's a bit expensive, it's a bit on the pricey side, so it's more often than not given in private hospitals. But it is something that is much better than even opting for a cesarean section. You know,
it's less invasive.
It's less invasive. It's less. The complications are less. You know.
What are the complications of an epidural?
It can fail.
Okay, and then the aftermath. So that headaches, backaches.
Backaches, you know. Complications are everywhere on everything that we do, but these complications are not very common, but they can happen, you know. The epidural can fail to work, it can still get the terrible pains, and you still have to be taken for a cesarean section and get terrible post-delivery headaches afterwards, you know. But most of these are manageable, and most of them go away with time. They do not remain there permanently.
Okay.
So if someone's main concern is, I do not want to experience pain, and they are able to afford a cesarean section, I would rather recommend you have your epidural.
Yeah.
You know, try normal labor, you know, rather than opting for a cesarean section, which comes with more complications.
Okay.
Yeah. I always recommend women to, like, it's good to stick to one doctor throughout.
Yes, because then he knows your history.
He knows your history. He has all your history. He knows where you've been coming from, how he has managed certain complications. So by the time you guys are discussing a birth plan, it's in totality. It's not just I'm seeing you for the first time.
Yeah.
I've seen you from when you conceived at 6 weeks, you're now 39 weeks, and now we now need to discuss.
So you can make informed decisions in cases of an
emergency.
emergency.
Yes, exactly. Okay. So that is why, and that's why WHO recommends 5 visits. Again, I have to repeat.
Yeah.
Yes.
True.
During the 3rd trimester.
To wrap up, doctor, in our 3rd trimester, we as women, we are nesting. Nesting, preparing for the baby, clearing the room space for the baby. We are buying clothes, we are buying. Now, most women, we do that, and like I said, it's nesting. But most mothers, expectant mothers, tend to forget about themselves because you don't want to go to the labor ward and you're already exhausted before you get there. So what can women do, expectant mothers, what can they do to actually prepare themselves for that day?
That's a very, very important.
With their partners as well, with their partners.
And that's a very,
because their support system.
Yes, and that is a very, very important point, because if a pregnant woman does not have any form of support system, any social network, these are women who are predisposed to postpartum depression, post-delivery. They are sad. They are happy they have got their baby, but they are sad because they are overwhelmed. It's too much for them. The baby is crying all the time. The baby is not sleeping. The baby is refusing to breastfeed. They don't know what's going on, especially for first-time mothers. And that is why, especially like at Kampala Hospital, we encourage women, aside from seeing a gynecologist, we encourage women to attend what we call antenatal clinics. Now, these antenatal clinics are guided by our midwives who talk to these mothers about breastfeeding, about taking care of this baby, about issues that are going to arise after delivery.
Immediately after delivery,
after childbirth, what to expect, how to breastfeed, what to do,
Yes.
We encourage mothers because, like I say, you're going to get a lot of advice from friends and family who mean well, which might not work for you and your baby.
True.
But if you come to a hospital and attend with other pregnant women and you're guided by a midwife, this midwife has experience, she will tell you what to expect, because knowledge is power. And if you know what to expect, you will not be overwhelmed as compared to someone who doesn't know what to expect.
True.
A midwife will tell you, for example, that it's not what you see on TV that a mother begins to breastfeed immediately. Sometimes it can even take as long as 2 weeks before milk comes out. That's at the back of your mind, if you know that, and this is a 4th day, you're well prepared, you're not overwhelmed with too much emotion. Oh, my baby is not, you know that if you can't breastfeed, let me give formula. The midwife said this. Because that period of after giving birth, that 6 week to 3 month period it can overwhelm many women, especially if they don't know what to expect. Yes. So that's why we encourage also male partner involvement.
For that extra support.
Yes, come with your husband, discuss it, 3 of you, discuss what to expect. Any questions that both of you are not sure of, ask and the doctor explains, Attend the clinics, which are held here every Saturday, such that you can be advised on what to expect. The doctor will take your pressure and say, take this medicine. But those clinics, those classes, the midwife now talks about these normal issues. How should you bathe the baby? What is the temperature of the water you should bathe the baby? How often should you? Such small things. They look very, 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 very small, but they are very important and can go a long way in preventing, anxiety and stress and such things to a mother after delivery.
Well, thank you so much, doctor. Thank you so much. I've learned a lot today.
Oh, that's good. That's very good.
Well, that is all we had for you on our segment of wellness this morning with me, Sandra Cope, and I have been speaking to Dr. Martin Adupet, who's an obstetrician and gynecologist here at Kampala Hospital in Kololo. Well, now you know what to do to prepare for labor and childbirth. Head on to your gynecologist or obstetrician, health worker, and get your birth plan in the works, in the books. Well, that's all we had for you on Wellness this morning. Do not go anywhere because we have quite a show lined up for you. Stay at sea.